Ever wondered how NHS dental charges actually work? Why is it that patients might pay significantly more for the same or similar treatment in a private practice? Are patients being ripped off? Or could it be that private care is offering something extra? In today's video, we're diving into NHS Band 4 charges, what they mean, what they cover, and how do they compare to the private sector. I will be exploring how these differences affect both patients and dentists. Hi, if you're new here, my name is Komal and I'm a dentist based in the UK. In today's video, we're taking a closer look into emergency or Band 4 NHS charges. If you've watched my videos on Band 1, 2, and 3 charges, you'll already know how the NHS pricing works. But what happens if a patient has an emergency? That's when Band 4 comes in. Band 4 is for emergency treatments or urgent care. It typically includes treatments like antibiotics, extractions, emergency fillings, and even a dentist just assessing you and giving advice. Basically, it covers any urgent procedures that will get the patient out of pain or address an immediate dental issue. It's designed to give quick and critical dental care, which is why it focuses on immediate and necessary treatments. And here's the crazy part. For patients, the charge is currently fixed at £26.80, which is the same as Band 1. Dentists are paid 1.2 UDAs for Band 4 treatments, regardless of the emergency treatment that is performed. So how does this translate to the dentist's earnings? Let's go back to my example for the dentist that's getting paid £10 per UDA. If a dentist claims a Band 4, they will get paid £12. Band 4 will cover numerous different emergency treatments or just advice to the patient on how to manage their problem. Remember, to meet their annual targets, dentists need to complete thousands of UDAs per year. A typical NHS dentist will need to complete 30 UDAs a day, which is equivalent to seeing 30 checkups, doing 10 fillings, or making 3 dentures, or seeing 25 emergencies. Now let's compare this to private practice. For a similar emergency treatment, such as extraction or urgent filling, the cost in a private clinic will usually be broken down into 2 parts. Part 1 is the assessment, diagnosis, and advice. The cost of this can range from £40 to £100. Part 2 is the treatment that's required. If there is a treatment needed, this would be an additional charge on top of the initial charge for assessment. For example, you might be paying £200 for an extraction, £60 for re-cementing a crown, or nothing extra because you didn't actually need any treatment on the day. In private practice, dentists aren't constrained by the UDA system. Practices and dentists can set their own prices based on the time needed to do the treatment, the expertise, and the materials required. For example, if a patient's crown has fallen off and they've attended for an emergency, the private practice will charge an emergency appointment fee and then let's say £60 on top to re-cement the crown. They have accounted for all the staff, the material costs, and they understand this is usually a simple procedure that doesn't require longer than about 30 minutes to do. However, if the patient needs an extraction of their tooth, the practice may charge, let's say, £200 because again, they're accounting for the staff, the materials required, the expertise of the dentist, and the time required to complete this more complex treatment. The patient is charged accordingly. And let's say the patient has attended for an emergency, they've paid a fee for their appointment, and the dentist carries out their assessment, they find that the patient is okay and they don't actually need any emergency treatment, then the patient is not required to pay any more. I want you to understand how different all of these treatments I listed are. 1 is just giving advice, 2 is re-cementing a crown, 3 is doing a full-on extraction, and the NHS just bang it into one category. And this is why more and more dentists are moving away from the NHS and into private practice. The UDA and banding system doesn't compensate dentists fairly. It doesn't recognise the skills and expertise taken to perform a complex procedure or get a patient out of pain. I often hear this objection against private fees from paying patients. Why am I being charged an appointment fee? Why did I have to pay if I didn't need any treatment? The fees that private practices charge are not just for an appointment. It is to make a thorough assessment of the issue, to make a diagnosis, and to provide you with the most appropriate options for treatment. For example, if someone has a toothache, they will be paying a fee so the dentist can use their expertise to determine what is causing the toothache. If it was just as simple as paying for an appointment, technically patients don't need to come and see the dentist. I guess they can work it out for themselves. And anyway, once the patient has paid for an assessment and a diagnosis, they will always pay separately for the treatment that's required. I'm pretty sure this is the case in most countries around the world. However, because in the UK the NHS charges a flat fee for assessment, diagnosis and treatment, patients compare it to private practice and feel like they're being completely ripped off. But you have to remember, the NHS is the anomaly here, not the private practice. And what does this all mean for patients? If a patient needs emergency dental care and can't afford private treatment, then NHS Band 4 is a great option. It offers access to dental care at a fraction of the cost. I truly believe that it is very important to give patients the access to care that they need. Therefore, NHS dental emergency services are a great short-term option. I have locumed in several practices to provide these services. In my experience, the appointments are always short and rushed. And even if I know that a patient will benefit from a certain treatment, such as an extraction, in a busy NHS practice, I may not have the time or facilities to provide them with the most suitable treatment. So what ends up happening here? Antibiotics become the solution to every problem. And you, as a dentist, just feel helpless. We did not go to dental school to learn how to prescribe antibiotics for every single problem. Dentists are equipped with so much knowledge, and it's a shame that we can't always apply it. In contrast to this, I have also worked in private practices that provide emergency appointments. For those patients that can afford private healthcare, the treatment is likely to be more personalized, time is taken to understand the problem, and usually the best option is provided, not the easiest or fastest one. Sometimes patients may even leave with a long-term solution to their problem, which means they don't even have to come back again. And that is because the dentist had time to think and had time to execute. But I understand that the choice ultimately comes down to what level of care fits an individual's budget. So what's the takeaway here? NHS Band 4 covers essential emergency treatments, but due to this broken UDA system, it doesn't allow dentists to provide the highest standard of care. Private care, on the other hand, usually provides better financial compensation for the dentist and the practice, which leads to better treatment options being provided on the day of the emergency. It's truly a shame, and it is something that I hope changes, because I do truly believe that every patient should be entitled to care, and I understand that not everyone can afford private healthcare. Check out my video on why I think the NHS system is broken, because I've talked about a few solutions. That's all for this video. I would love to hear your thoughts. How do you feel about NHS versus private care? Drop your comments below, and don't forget to subscribe for more videos on NHS dentistry versus private dentistry, facial aesthetics, and how I'm doing as a dentist trying to navigate my way through this broken system. I will see you in the next one.